As the human body crosses the threshold of 60 years, its internal chemistry undergoes a profound shift, particularly in how the liver and kidneys process synthetic compounds. This physiological transition means that medications which were once considered safe or routine in middle age can suddenly become biological liabilities, increasing the risk of catastrophic cardiovascular events like heart attacks and strokes. The primary issue is polypharmacy, a state where multiple medications interact in a way that creates a toxic environment for the vascular system. When a person over 60 takes a pill, the substance remains in the bloodstream longer due to a slower metabolic clearance rate, leading to a cumulative effect that can damage the delicate lining of the arteries. To protect your heart and brain, it is essential to understand the hidden mechanisms of 5 common classes of pills that are often prescribed or purchased over the counter without a second thought. The first and perhaps most dangerous class of pills frequently used by seniors are non-steroidal anti-inflammatory drugs, or NSAIDs, which include common names like ibuprofen, naproxen, and diclofenac. While these are highly effective at masking joint pain and inflammation, their effect on the cardiovascular system is devastating for those over 60. NSAIDs work by inhibiting enzymes called COX-1 and COX-2, which are responsible for producing prostaglandins. While this reduces pain, it also causes the blood vessels to constrict and the kidneys to retain sodium and water. This combination leads to a sudden and significant spike in blood pressure, putting immense pressure on the heart muscle and the carotid arteries that supply blood to the brain. Furthermore, chronic use of these pills interferes with the natural anti-clotting mechanisms of the blood, making the formation of a thrombus or blood clot much more likely. For a 60-year-old whose arteries may already have some degree of plaque buildup, this increased clotting risk is the perfect recipe for an ischemic stroke or a myocardial infarction. Scientific studies have shown that even short-term use of high-dose NSAIDs can increase the risk of a heart attack by as much as 50% in older populations, yet they remain a staple in many medicine cabinets. The second group of medications that secretly accelerate heart and stroke risk are proton pump inhibitors, or PPIs, commonly used to treat acid reflux and heartburn. Medications like omeprazole and lansoprazole were originally intended for short-term use, but many seniors stay on them for years or even decades. The hidden danger of PPIs lies in their impact on the endothelium, the thin layer of cells that lines the inside of your blood vessels. Research has discovered that PPIs can inhibit an enzyme called DDAH, which is necessary for the production of nitric oxide. Nitric oxide is the body's natural vasodilator. It tells the arteries to relax and expand to maintain healthy blood flow. When nitric oxide levels drop due to chronic PPI use, the arteries become stiff and less responsive, a condition known as vascular aging. This arterial stiffness is a primary driver of high blood pressure and increases the likelihood of a stroke. Additionally, PPIs significantly impair the absorption of critical nutrients like magnesium and vitamin B12. As established, magnesium is essential for maintaining a steady heart rhythm, and B12 is required to keep homocysteine levels low. When these nutrients are depleted, the heart becomes susceptible to arrhythmias, and the brain is exposed to high levels of neurotoxic homocysteine, further elevating the risk of a stroke. The transition into the third dangerous category involves calcium supplements, which are almost universally recommended to seniors for bone health. However, without the correct biological cofactors, these pills can become a major threat to the heart. This is known as the calcium paradox. When a person over 60 takes a high-dose calcium supplement without vitamin K2 and vitamin D3, the body is unable to direct that calcium into the skeletal system. Instead, the calcium remains in the bloodstream and eventually settles into the soft tissues, specifically the walls of the coronary arteries. This process, called vascular calcification, turns flexible arteries into rigid, bone-like structures. This not only increases blood pressure, but also makes any existing arterial plaque much more unstable and prone to rupturing. A ruptured plaque is the immediate cause of most heart attacks. By flooding the system with inorganic calcium carbonate or citrate without the necessary guidance from K2, you are essentially liming your pipes, creating a physical blockage that restricts blood flow to the heart and brain. It is vital to recognize that after 60, the way the body handles minerals changes, and what was meant to strengthen the bones can easily end up clogging the heart. Understanding these first three categories is the first step in auditing your health routine to ensure that your attempt to solve one problem isn't secretly creating a far more lethal one within your cardiovascular system. The fourth category of medications that presents a hidden but significant danger to the cardiovascular system of individuals over 60 is a specific class of diabetes medications known as sulfonylureas. While managing blood sugar is critical for preventing long-term vascular damage, drugs like glyburide, glipizide, and glympyride can create acute risks that far outweigh their benefits in older populations. The primary mechanism of danger is the induction of hypoglycemia, or dangerously low blood sugar. In a younger person, the body can often compensate for a drop in glucose, but after 60, the counter-regulatory systems are less efficient. When blood sugar drops too low, the body perceives it as a life-threatening emergency and releases a massive surge of adrenaline and norepinephrine to force the liver to release stored glucose. This adrenaline storm causes an immediate and sharp increase in heart rate and blood pressure, which can trigger a fatal arrhythmia or a heart attack in a heart that is already stressed by age or existing plaque. Furthermore, research suggests that sulfonylureas may interfere with a natural protective process called ischemic preconditioning. This is the heart's ability to toughen up and protect itself during a period of low oxygen or a temporary blockage. By blocking the potassium channels in the heart muscle cells, these pills may actually strip the heart of its natural defense mechanisms, making an accidental blockage far more likely to result in permanent tissue death or a total cardiac arrest. For seniors, the narrow therapeutic window of these drugs makes them a high-risk choice, especially when more modern alternatives that do not cause hypoglycemia are available. The fifth and perhaps most overlooked class of pills that increase heart attack and stroke risk are anticholinergic medications. This is a broad category that includes many common over-the-counter sleep aids, allergy medications containing diphenhydramine, and drugs prescribed for overactive bladder or even certain types of depression. These medications work by blocking acetylcholine, a neurotransmitter that is essential for the function of the parasympathetic nervous system, which acts as the body's natural brake for the heart. When you inhibit this system, the heart is left in a state of sympathetic dominance, meaning the gas pedal is constantly being pressed. This leads to a higher resting heart rate, also known as tachycardia, and a reduction in heart rate variability. For an individual over 60, a heart that is forced to beat faster and harder for extended periods because of a nightly sleep aid is under constant mechanical stress. This increased workload significantly elevates the demand for oxygen within the heart muscle, and if the coronary arteries are even slightly narrowed, it can lead to silent ischemia or a sudden heart attack. Moreover, anticholinergics are notorious for causing orthostatic hypotension, a sudden drop in blood pressure when a person stands up. This instability in blood pressure regulation can lead to fainting and falls, but more importantly, it causes repetitive microstrokes or transient ischemic attacks as the brain is momentarily deprived of adequate blood flow. Over time, this instability damages the small vessels in the brain, drastically increasing the risk of a major hemorrhagic or ischemic stroke. Beyond these 5 individual categories, the true danger often lies in the interaction between these pills and the body's natural aging processes. After 60, the kidneys have a reduced glomerular filtration rate and the liver has less blood flow, which means these drugs linger in the system far longer than the manufacturer's recommended dosage suggests. This leads to a state of chronic medication buildup. When you combine the vascular stiffness caused by PPIs with the blood-thickening effects of NSAIDs and the electrolyte imbalances often caused by blood pressure diuretics, you create a biological environment that is primed for a vascular catastrophe. The endothelium, which should be smooth and flexible, becomes inflamed and prone to tearing. When a tear occurs, the body's clotting factors, now heightened by the presence of these medications, rush to the site and form a blockage. If this happens in the coronary artery, it is a heart attack. If it happens in the carotid or cerebral artery, it is a stroke. This is why it is absolutely vital for anyone over 60 to undergo a comprehensive medication audit. Many of these prescriptions are legacy drugs that were started for a temporary problem years ago and were never discontinued, despite the changing needs and vulnerabilities of the aging body. We must also consider the impact on the autonomic nervous system. The heart is not an isolated pump. It is deeply connected to the brain through the vagus nerve. Many of these common pills, particularly those with anticholinergic effects or those that alter mineral balance, disrupt the electrical signaling of the vagus nerve. This disruption can manifest as atrial fibrillation, a common heart rhythm disorder in seniors that increases the risk of stroke by 500%. When the heart's electrical system is haywire, blood can pool in the chambers and form small clots that eventually travel to the brain. By unknowingly taking pills that interfere with this delicate electrical balance, you are essentially gambling with your cardiovascular health every single day. The path to safety involves shifting from a reliance on synthetic chemical band-aids to a focus on the underlying physiological causes of pain, reflux, and sleep issues. Addressing the root cause through targeted nutrition and lifestyle adjustments can allow for the safe tapering of these high-risk medications under medical supervision, thereby significantly lowering the statistical probability of a heart attack or stroke and ensuring that the heart and brain remain resilient and protected through the later decades of life.